Hi everyone, this is Travelhealer. Today I'm going to be talking tip of the day. Tip of the day is dealing with a condition called TMJ, Temporary Mandibular Joint Dysfunction. Now this week has been great. I used to treat TMJ in the past, but someone's coming for a condition with TMJ, and one of the things about TMJ is that people often describe a pain when they chew on a steak, or sometimes they just constantly have an aching in the jaw. Most of these people usually grind their teeth, and usually most people who suffer from TMJ usually in their workload or in their life they tend to be more stressful, and even sometimes in their work, whether it's doing computer work or doing manual work or doing lots of studies, all the upper body tense up, and people tend to be stressful. They grind they clench their teeth during the day, and sometimes at night time they grind their teeth. Usually people like this might not notice they grind their teeth, but they often find there's pain in the jaw. But unless they have a partner who slept next to them, they will tell them, yeah, honey, you tend to grind your teeth at night, that's why. Anyway, now to treat TMJ is not that difficult if you know how. So here with me is Bonnie, my assistant. So I'm going to show you how it's done. We're using a little pinky finger to treat this condition. One simple trick is very simple. We use that little finger and we're going to put, say for example, you have TMJ on this side. We're going to put this up into the mouth. So what we do is imagine this toothpick I got here is a little finger. So what you want to do is, with my Bonnie's assistant right here, as you can see, if hypothetically speaking, if Bonnie opened his mouth, you put the little finger, this is a little toothpick, you put it in here and it's under here, as you can see, right in here. And you slightly open your mouth and you manipulate up here, up in this region here, in here. Now, so why in that region? Well, very simple. In our facial, we have this region here called the mandible, and up here we call it the temporal. So TMJ is basically most people who suffer pain in this area here. We call it TMJ right here, the junction right here. Because when we move our mouth, this would move, come down and come up. Okay, but within this area there's muscle, and the muscle that causes this problem is predominantly we have the masseter. There's a muscle sitting here, overlay here. It's called the masseter muscle, this muscle here. But underneath this muscle we have other muscle. We have a muscle that runs across here, in here, the deep sound. There's a muscle run across. We call it the lateral thyroid muscle. But also underneath we have what we call the medial thyroid muscle as well. These muscles are responsible for a lot of jaw action. So that's why what happens is during the day when you clench your teeth, your mastoid muscle will contract, but at the same time when this contracts, the deeper muscle, you have the lateral thyroid muscle, and the medial also bring the jaw in. The deeper muscle, it connect and lock the jaw. But what happens is during the nighttime, you're also, people who stress tend to clench their teeth and constantly contracting this. Over time, this muscle gets so exhausted. That's why eventually people often complain about their jaws kind of the deep aching. Sometimes they eat something, they chew too much, like say for example, eating on a steak or eating anything that requires a lot of chewing, it tends to cause their jaw to be very painful. And sometimes when they open their mouth, they feel like it's difficult to close or difficult to open. Among other things, like they tend to, when they move their mouth, it feels like a clicking sensation. Because what happens, these muscles get very tight and the circulation is affected. So what happens is the internal between the muscle connected with the ligament become hardened. So that's why movement of this joint produce this clicking sound over time. So anyway, to keep it short and simple, at the tip, little finger. For example, I have a pain on this side. Open my mouth slightly, in here, like that, all the way to the end, and just move the little finger last slightly open, and like that. We just do this motion. Okay? And sometimes we can go here and just massage here. Right. Or sometimes do like that and do both sides you can. Even there, as a matter of fact. Now, as you can see, I'm doing this, it's quite easy for me, but for some of you who actually have this condition, it's quite painful. Okay, and pinch the skin. I know. Because what happens when you have this condition, even the skin pinching is quite painful. So pinch, massage, here, and also up here as well, okay? This temporal area, this muscle here also connected into this region. It also affects the jaw pain. So it's good to massage up here as well. Massage here, right? Put a finger here and do this. Open and shut your mouth. Open, shut, and twirl your little finger. Well, you do this and you work into, it's going to be painful, but continue doing it. You can do it probably 2 to 3 times a day. Now, it's going to be very painful, but keep doing it. And also, it could be sore for 1 to 2 days. But the more you do, what happens, why you do it? The more you do, the more you're actually moving the lactic acid or the waste away from this muscle and bringing fresh oxygenated blood into the area. Within a week, eventually you will notice both your jaw, the pain will subside, it will become much better. Now, it's also good to do both sides, okay, to even out. So keep doing that. Now, there's more trick to treating this condition. That's just a simple version of how I treat TMJ. If you like my what I describe, please subscribe.